Welcome to this explainer. Today, we're diving straight into something that causes an absolute ton of anxiety for families, but is honestly completely misunderstood by most people: childhood constipation. We're going to unpack the science, the behavior, and the biology behind this incredibly common issue, relying directly on our source material today. Okay, let's just dive right in and separate the myths from the facts. Picture this. It's been 4 days. No poop. Cue the universal parental panic, right? Naturally, you jump online, and what happens? A quick internet search just throws you into an overwhelming, contradictory mess. One website confidently tells you it's perfectly normal, while another literally screams that it's a medical emergency. Meanwhile, well-meaning family members insist your baby needs immediate intervention. Suddenly, everyone's an expert. But here is the fascinating twist that our sources reveal. Many children who are treated for constipation aren't actually constipated at all. And this brilliantly illustrates our first major point. Say you've got an infant who is feeding well, gaining weight, sleeping normally, and is generally just a perfectly happy, smiling baby. But the diaper is empty. Who are we actually treating here? Are we treating a sick child, or, let's be honest, are we simply treating the parent's anxiety because they opened a diaper and didn't find what they expected? It's a vital curiosity gap we need to cross. To figure that out, we actually need to completely redefine the problem. Constipation is fundamentally about pain, difficulty, and discomfort that interferes with normal life. It is not simply failing to poop every single day. That's a huge myth. Frequency alone tells us almost nothing. Doctors don't count days. They look at the whole child. They're asking, are they growing? Are they active? Most importantly, are they comfortable? So the crucial point is understanding what is actually normal for different bodies. Take a breastfed baby, for instance. Breast milk is such an extraordinary, perfectly designed food that an infant's body absorbs almost all of it. Because they digest it so efficiently, there's very little waste left behind. So a perfectly healthy breastfed baby might go 5 or even 6 days without a movement. Now, compare that to an older child who might have a bowel movement every single day, but still suffers from severe constipation because every trip to the bathroom is painful and incomplete. All right, let's move right along to section 1, the vicious withholding cycle. This is where things really shift as kids grow up. Because once we move beyond infants, the primary culprit for constipation drastically changes. It's usually not genetics, it's often not even a flaw in their digestive system. The biggest cause is entirely behavioral. Picture a child. They're playing outside, sitting in class, or totally engrossed in their favorite cartoon. Suddenly, they feel the urge to go. But they decide to wait. Why? Well, maybe the school restroom feels dirty to them. Maybe they're embarrassed to ask a teacher. Or honestly, maybe they just don't want to hit pause on their cartoon. So they ignore the signal. Now, holding it just once seems totally harmless, right? But here is where the biology kicks in hard. When they hold it, the stool stays in the rectum longer. And as it sits there, the body continues to absorb water from it. This makes the stool larger and a whole lot harder. So what happens next? The next time they finally go to the bathroom, it hurts. Passing that hard stool causes real pain. Now, the child associates the toilet with pain, which makes them afraid. So the next time they feel the urge, that fear causes them to hold it again. Pain leads to holding leads to harder stools cause more pain. It's a vicious biological loop, and it's literally one of the most common causes of chronic constipation. So how do we break this cycle? That brings us to section 2, the arsenal: diet, hydration, and routine. Interestingly, breaking this doesn't always start with rushing to the medicine cabinet. It starts with understanding how to give the colon exactly what it needs. We have to start with food, but maybe not in the way you'd think. A lot of parents think highly processed food just clogs the system. But the real issue? Ultra-processed foods are so completely absorbed by the body that they leave very little waste behind. The colon physically needs volume, it needs bulk, to trigger a strong muscular urge to have a bowel movement. That's exactly why introducing fiber-rich foods like oats, beans, and fresh vegetables is so absolutely crucial. They don't just magically clean the intestines, they create the physical volume the colon requires to do its job. But think about it. Fiber alone just isn't enough. Imagine trying to sweep dry concrete with a broom. You aren't going to get very far. Now imagine trying to move soft, damp sand. So much easier, right? If a busy kid forgets to drink water, especially after playing sports or being out in hot weather, the large intestine simply pulls more moisture right out of the stool. It renders all that healthy fiber you fed them completely useless. Sometimes the absolute most effective medical intervention is just handing them a water bottle and making sure it gets emptied. Beyond just diet and hydration, we really have to look at the child's environment. Because unlike adults, kids generally won't just go when they feel the urge, especially if they're in uncomfortable public restrooms or feeling rushed. If a child repeatedly avoids the bathroom away from home, they aren't just being stubborn. They are reacting to an environment where they don't feel entirely safe, secure, or comfortable. To combat this, creating a regular, safe, and unhurried toilet routine at home is a real game changer. And the science points us to a very specific time, immediately after breakfast. Why then? Because the very act of eating a meal naturally activates the digestive system. Giving a child a dedicated, pressure-free window in the morning can make an enormous difference over the course of weeks and months in retraining their body's rhythm. Let's look at Section 3, when to seek help, because we have to be realistic here. Sometimes home routines and diet tweaks simply aren't enough. If a child has been caught in that vicious withholding cycle for months, the rectum may actually become physically stretched out. Because it's stretched, it takes a much larger volume of stool before the brain even recognizes the physical need to go. This is where medical intervention steps in, and it's not a quick overnight fix. Pediatric guidelines often recommend safe stool softening medications, like polyethylene glycol or lactulose, for weeks or even months. The way these work is incredibly smart. They safely draw water into the colon to keep the stool soft and easy to pass. It literally breaks the fear-pain cycle. And it's so critical to rely on this kind of structured medical guidance rather than using harsh, stimulant laxatives or questionable home remedies you found on a forum. And speaking of medical guidance, you absolutely need to know when to escalate things. You should contact a healthcare provider immediately if you see real red flags like severe abdominal swelling, repeated vomiting, or poor weight gain. Why? Because everyday functional constipation is almost never the only symptom of a serious underlying illness. If there is a dangerous condition present, your child's body will give you these other warning signs for sure. Fortunately, those dangerous conditions are very rare. The vast majority of the time, the ultimate goal isn't to diagnose a rare disease, and it definitely isn't just to produce one single bowel movement today. The goal is restoring a long-term, pain-free pattern where the child completely stops being terrified of the bathroom. As the medical guidance often reminds us, a happy, growing, energetic child is telling you much more than a calendar ever will. Which brings us to our final takeaway. Healthy digestion isn't about counting days. It's about comfort, fearlessness, and pain-free living. Sometimes the absolute best treatment is simply stepping back and understanding what is actually normal for human bodies. Thank you so much for joining this explainer. I want to leave you with this thought. The next time a health issue arises, are you measuring success by arbitrary data points on a calendar, or are you actually looking at the human experience of the child right in front of you?